Good evening. Welcome to part two of Los Angeles County Safe Schools for All School Health Panels. We're excited that you decided to join us for this second and final school health panel. We look forward to another great dialogue. I'm your moderator, Kimberly Brown, and I work on the Safe Schools for All Awareness campaign. Tonight's panel is targeted to African American and multicultural parents in Los Angeles County. Our goal is to provide you with critical updates and information regarding your students returning safely to in-person learning this upcoming school year. Before I briefly introduce our panelists and then we hear from them, I'm just going to go over brief agenda as well as some general instructions. So our agenda, I'll go through general instructions, brief introductions, we'll hear from our panelists, and then we'll move on to the Q&A portion. Tonight, if you have any questions, please submit your questions via the Q&A function. We will get to as many questions as we possibly can, but we encourage you to submit them via Q&A. And if you're having any connectivity issues, we just recommend that you log out and log back in. Hopefully that will solve what your connectivity issues. We have a robust panel, so I'm going to jump right in. We're going to briefly hear from all of our panelists, as well as kick it off with Dr. Naomi Burdock, who is Associate Professor of Pediatrics and Policy in the Department of Pediatrics at USCF. She's also our Safe Schools for All team lead. We have Dr. Michelle Bowers, who is the Superintendent of Lancaster School District. We have Dr. Jerry Abraham, who is the Director of Vaccines at Kedron Community Health Center. We have Jewel Forbes, who is the Project Director of Community Health and Safe Schools and the lead for school counseling and school-based mental health with LACO. We have a parent advocate, JP John Perrin, who is a part of LAUSD Community Advisory Committee, as well as a student advocate from Reseda High School, Neil Pouchon, and he's a junior. We also have Dr. Sophia Lopez, who might be joining us. She's a pediatrician, as well as Gary Hardy Jr., who is the Director of Policy and Advocacy with the Social Justice Learning Institute. And he's also the president of the Linwood Unified School District Board of Education. We're going to start with Dr. Naomi Burdock. I'm going to stop sharing my screen because she does have a presentation.
Wonderful. Thank you so much, Kimberly, and welcome everybody. And a deep note of gratitude to all the people who are joining us on the panel today. And really looking forward to this panel and appreciate all the work that's been put into it, and hopefully it'll be really helpful for the families and for the members of the school community who are joining us from LA today. So I'm going to share my screen. Hold on one second. And as Kimberly said, I'm Naomi Burdock. I'm a doctor at the University of California, San Francisco, but specifically actually at the County Hospital in San Francisco. And the perspective I bring is both a pediatrician taking care of Latinx and African American and Black families in the clinic at San Francisco General Hospital, the County Hospital in San Francisco, where from the early part of the pandemic, really seeing how much the need for school, the desire for school for families, particularly who are getting impacted by the pandemic even early on. That's the perspective that I bring and sort of what brought me into this work, as well as, of course, being a parent and trying to understand as a scientist, as a researcher, as a doctor, what is the right way to do this? What is the best way we can do school that is safe, but also school that is successful, that allows kids to walk through the door, sit in those seats, learn, hang out with each other. So those are the perspectives that I bring. Sometimes people say, oh, you only look for the answer that you want, but my commitment to all the families that I work with and to all the schools that I work with is that I look at all the information. We're all looking at all the information to find out what is the right way to do it. There's no answer that we're saying, oh, I want to find information that supports only one answer. We're always trying to find the right answer, the best answer, looking at what we're learning from COVID over time. So with that, I wanted to tell you guys a little bit about the Safe Schools for All initiative. That's what I'm leading at the state right now. And it started in December 2020. And it's based on a framework of how are we going to do safe and successful schools It is 4 different, sort of what we call pillars, meaning there's 4 different pieces of what we're doing, one of which is funding, dollars. We know that doing schools in COVID is not straightforward. It needs some extra dollars, and it needs extra dollars reflecting the needs of the communities. So there are some communities that were underfunded in their schools even before the pandemic. So the dollars that are coming in have an equity basis to them, meaning that they're distributed, understanding that difference from before, and that more dollars need to go to those schools that were already historically sometimes underfunded. There's also hands-on assistance, meaning we can give people dollars, but we know it's complicated. They should get additional information, technical assistance, help with figuring out how to do things. And then safety measures, which are like tangible things, including masks, and including testing, which is a big program that is really, particularly this year. We had testing last year, but it is such a robust program this year with dollars from the federal government as well as from the state government supporting free testing for schools this year, walking into the school year. And then finally, transparency and accountability, which is we have a website that really is supporting, it's a schools, we call it the Schools Hub, and we'll give you the link at the end of the presentation. It supports people understanding what is a safe school, how can I understand more about it. It has a parent page to it that is hopefully very helpful resources for parents. So particularly for anybody on the webinar who's trying to understand what are the questions that I can ask my school, how do I get informed and empowered to understand what's going on. And as I mentioned, equity is core. It's actually part of all of the 4 pillars that are listed above, because we really, it's a core piece of what we do, understanding that there are some communities really disproportionately impacted more than others by the pandemic, and recognizing that and giving resources to those communities as much as we possibly can to support them. And then finally, safe state and local efforts, combining. We know we can't just sit up at the state level and say, here's how to do it. It's always a partnership with the local people, understanding how are we going to support people to do vaccines, testing, masking, and ventilation. And part of these webinars is actually to support that local piece. It's not just a state person, me coming and talking about it. It's people locally from communities coming and talking about what's going on the ground too with families. So a little bit more about the funding, particularly to support school safety in kids. The funding is over $25 billion for schools throughout the state of California, coming, like I said, from the federal government, the national government, as well as the state government, to support those key things: masking, ventilation, which is getting air flowing through the classrooms, COVID-19 testing and cleaning, and then not just those public health things that I just listed, but also the educational stuff, supporting extra instruction, making up for learning losses, social and emotional and mental health services. And then finally, a network of county education and health departments. So making sure that at the county level, also that education and public health are talking to each other to support people on the ground to do those safe schools. So what do we know about the sort of public health science? Since the beginning of the pandemic, we are constantly learning and watching and understanding what's going on. The bottom line is that research shows that schools can open safely and stay open. So what, this is a slide because I'm a pediatrician. We, in the very beginning, we said schools are probably going to be a place where kids are just going to spread COVID. It's what they do with every virus we know. They get a cough, they get a cold, they pass it along. Parents know that extraordinarily well. Teachers know that. We know that kids pass them around. It was a huge question in the beginning, and as part of the reasons that the schools all shut down in the very beginning of the pandemic was this big question: are kids going to pass it around? It turns out, though, that kids do not get COVID-19 as often, nor do they get as sick as adults. So why? Why do children get COVID-19 less often and are not as sick? It turns out that there's something called the ACE2 receptor, which is the entryway on our cells. It's a little receptor on our cells for SARS-CoV-2, that virus that causes COVID-19. You don't have to remember the word ACE2 receptor. Just remember it's the doorway to get into the body. And our ability to make that doorway varies with age, meaning the elementary school students make less of those doorways than middle and high school students, who make less of those doorways than adults. And the implication to that is that if you have fewer doorways, you get less disease and more mild disease. And that's actually true for Delta as well. And I'll talk more about Delta in the next couple of slides, but this is a learning that is true, that Delta also, kids compared to adults get less disease and more mild disease, even with this new variant. The other thing we've learned is that most school-age children get COVID from a household adult, and that's been really consistent. Studies from Greece, Australia, China, Switzerland, Chicago. It's even when schools are open, that's where the transmission is happening. That's where kids are getting it. And it kind of makes sense when we think about it for a second. We have close contact with our family members. In our households, we take off our masks, we snuggle with our kids, we eat together, right? It's very intimate, close contact, and it's much more so than in schools. And we've seen that schools that are open during COVID, they're very good at creating routines and helping kids mask consistently and work together to do those safety layers. So the implications from this, the take-home message, is that vaccination for adults in the community, adults at home, teachers, and school staff, is really a key to preventing infections, to preventing infection in kids, and it provides a wraparound layer of protection for kids. It just prevents because the adults are part of where we get it from, the kids get it from, it protects them when the adults get vaccinated. And then finally, the things that also we've learned from studies around the world, nationally, in California, is that schools can operate safely when there's key layers in place. So this is what they call the Swiss cheese model, which is if you have these layers, these safety layers in place, that you can, there might be a hole in one part of the safety layer, but if you have another safety layer on top of it, the hole's in a different place, and you have another safety layer on top of that, the virus can't get through. So we know that if you only had one safety layer, the chances of the virus getting through is higher. But when we put the layers together, we can actually have safe and successful schools. And that's what is guiding us for the coming year. It's what we learned last year, and it's what guides us this year. So let's talk about this coming year. The priority from the CDC, the big National Advisory Council, also the American Academy of Pediatrics, also the California Department of Public Health, is to support and emphasize full in-person learning that's safe in this school year. We want to support the education. We want to support mental, emotional, and social development of kids. And we know that in school is the best way to do it. So the guidance that recently came out from the California Department of Public Health, it just got updated a few weeks ago. And I'm going to briefly describe it. It aligns with the K-12 guidance also from those national scientific advisory bodies, the Centers for Disease Control and Prevention, and the American Academy of Pediatrics. And it takes that layered approach just like those other groups do. So what are those layers? I'll go over each one of them. COVID-19 vaccine, it's a game changer. It is safe and it's effective, and it's everybody who's 12 and older is eligible for it. And we know that COVID-19 is the way out of this pandemic. And like I said, it creates that really strong safety layer for kids in schools. The more people are vaccinated, the less the virus passes around, the less likely it is to affect our in-school, any in-school infections and any in-school transmission. Masks. Masks are a universal mask requirement. That's true for CDC, that's true for AAP. They're required indoors, and outdoors they are optional. There are some schools who are going to actually require them outdoors as well, but masks are a simple and effective way of decreasing the risk of the virus passing from one person to another. And part of that reason is because it's actually what's called an airborne virus. It passes from one person through the air to another person. That mask being in the way, it just creates a barrier. It's remarkably effective. It's been shown to be effective in, again, multiple different places around the world and in multiple different circumstances, including in schools. It's been a really great layer for our kids. Ventilation just means airflow, what's coming in and out of the classroom. Oh, and I'm sorry, I forgot to explain. Indoors required, outdoors it's optional because outdoors is actually safer than indoors in terms of the transmission piece. The virus disperses, meaning it goes away much more easily outdoors. The sun actually affects it, so it makes it less easy to pass. And so ventilation actually makes the indoors more like the outdoors. And the other layer is a hand washing layer. We know that hand washing is great to decrease the risk of infection in anything, and particularly in COVID-19. So just, keep on washing those hands, keep on encouraging your kids to wash their hands, and stay home when sick. So when you have symptoms of any kind of illness, good idea to stay home, get sick, get better. And we know that COVID-19 can actually have pretty mild symptoms in kids sometimes. And so keeping them home when sick and getting them tested. And there's a lot of support to get those testing done so they can come back to school and we know that they don't have COVID-19, and you can feel sure that they don't have COVID-19. Testing is something that, like I said, can help us understand if somebody has symptoms, whether or not they have COVID-19 or not. And it can actually detect the virus before your child or other students or a staff member, a teacher, even starts to feel sick. And so some schools are choosing to do regular testing with their unvaccinated students and teachers to help everyone stay safe and stay in school. It's a way of figuring out, even before the school opens, is there any virus, and having people stay home if there is virus, and then doing that consistently throughout the school year. I'll mention that there's actually $1 billion from state and federal dollars to support school-based testing particularly. And California has one of the strongest programs actually in the nation. People come and ask us, how are you doing this? And tell us more about what California is doing for their testing, particularly for schools. So lots of good supports for free testing from those $1 billion, okay? So then the other thing is that transparency means that the school should have information available to parents, to teachers, to anybody who wants to understand what's the safety plan. And so that's part of our guidance is actually to say, let's have that transparency. You recommend posting that safety plan and sharing it with families. And that's partly because we know a lot of what we need to do together as a community is to have trust and collaboration, and that transparency supports that. I wanted to talk about the Delta variant because it's a big topic for everybody. We're thinking about it a lot. We're paying close attention to it. It's worrisome. There's a lot of conversation about it because it's more contagious, but we have some key tools. We've known about this Delta variant for a while, watching sort of what's going on, preparing ourselves. We know that hospitalized patients are adults. Almost all of them are adults, and it's not affecting kids the same way the original virus didn't. It's really affecting adults more, and the vast majority are the unvaccinated adults, which means, again, we're learning vaccines are very effective. Even with Delta, they slow the spread, and it's important actually to be fully vaccinated. So there's a type of vaccine you can get. Most of the vaccines for COVID take 2 doses. And we found that for Delta, that second dose is particularly important. So if you know anybody who's gotten 1 dose, but they're supposed to be getting 2, encourage them to get that second dose to help be fully protected. And then of course, keep wearing those masks. Like I said, simple and effective, and stops that transmission from happening. So this is just the picture of what are our key layers. You'll see vaccines, vaccines, vaccines. That's the Swiss cheese model has lots of layers of vaccines, really great. Masking, ventilation, testing, and stay home when sick. And I'll just finish by saying, point you guys to the schools hub and the parent page. The link is at the bottom. It has a very specific parent page, both in English and in Spanish, that can support people to learn more and be able to empower you to ask questions about sort of what does it mean to have a safe school, and any other sort of resources that might be helpful for parents. And with that, I will stop sharing my screen, and I look forward to the question and answer and hearing from all of our other panelists today. Thanks so much.
Perfect. Thank you, Dr. Burdock. Next, we'll hear from Dr. Michelle Bowers.
Good evening, and thank you very much. My name is Dr. Michelle Bowers, and I am the proud superintendent of Lancaster School District in Lancaster, California, out north near Magic Mountain, for those of you that are wondering where Lancaster is. But we are still part of LA County, so I'm pleased to be part of the panel and the conversation this evening. I'll be sharing this evening some of the things that we are doing in our district, but many of the things that I'll be sharing will be applicable to other districts as well. Please understand that in Los Angeles County, there are 80 school districts, plus charter schools and other private schools as well. So each district will be, they have their own set of rules. We have mandates that we all adhere to that are as far as the reopening guidance, for example, from the Los Angeles County Department of Public Health and from CDC that mandate what we are required to do, specifically the mask inside, where all students, all staff members must wear masks indoors when they return to school. And that is a mandate from the Department of Public Health and from CDC right now. So you'll find that to be a common thread with all school districts. In addition to that, when you talk about, Dr. Burdock talked about layers from a medical lens, from a school lens, we too have layers that we are looking at as far as ways to mitigate some of the spread and transmission and to increase the safety level as we return students to school. So some of those factors would and could include, you'd have to check with your school district, shields that are in the classroom around the desk for the students, shields for teachers. We also are looking at spacing where possible, so there may be some additional spacing things that are taking place. Breaks that are consistent to provide opportunities for students and staff members to go outside, take their mask off if they choose to, and be outdoors in ventilation, get some fresh air. So there are those types of breaks built into the day. I know that there's concern about students keeping their mask on all day long, nonstop. Well, obviously they will be taking them off when they go to recess or have an opportunity to take them off, but especially when they eat. So what kind of accommodations, what will that look like when they have a lunch break or a snack break? But please know that everyone, we have layers. We've looked at ways that we've improved our cleaning and disinfecting protocols. So in between everything where there's frequently touched areas, we are making sure that we've increased our protocols as they pertain to cleaning of those areas, disinfecting of those areas, playground equipment, sharing or not sharing rather of personal school supplies. In every instance where we can, we are trying to encourage people to bring their own backpack, or we provide them individual sets of school supplies and limit the amount of sharing to a great degree, much more than it used to be. We also have in many districts, my district, we have provided HEPA filters inside of all of the classrooms to further purify the air and circulate the air in the classroom setting. So we know that we have more little bodies than a big body in there that are going to be in this one space. But we do have, in addition to the new MERV filters in our HVAC systems, we have also put HEPA filters in there, and we have the shields, and we have hand sanitizers throughout, and we have purchased some additional hand washing stations and made them available in some areas outside on the playground area. So we have really encouraged a lot of increased hygiene efforts, not just for staff members, but teaching our kids to do this. This journey didn't just start yesterday. So we've been going through this for the last 16 months. And in the last 16 months, we have learned a lot about how to respond to this, to help create safe environments, but also our kids. Because I remember back in March of 2020, March, April, when this first happened and schools were closed, there was a lot of concerns about the adjustment to people getting accustomed, especially kids, accustomed to wearing masks frequently. But what we've seen, and my observation is, the kids are very resilient and they're fine. And they're very comfortable with it, the little ones and the big ones in most instances. So as I walk around, I see people that are very comfortable with it, and the kids, it's just a common thing now for them. So we are looking forward to the reopening of schools and the return of our students. And the reception, our schools open Tuesday. Some school districts have already started to open, and I know that there's a few others additionally that will be opening next week. But I can assure you that schools and school districts are ready to receive our kids in the safest way possible. We have had large campaigns to promote vaccination amongst our staff and to promote vaccination for youth that are eligible to get the vaccine. So I encourage you, if you have not, to please seek additional information that could answer any questions that you might have or address any reservations that you might have, or hopefully you will be provided some information this evening that will alleviate any concerns that you might have about the vaccine or about returning your child to school at this time. But we're excited to have our students back on campus after having been out for so long. And I would just encourage you to give us an opportunity to show you that school is absolutely safe and the best place for our students. Thank you.
Thank you, Dr. Bowers. Let's go with Dr. Abraham. I think that this will be a perfect segue into talking a little bit more about the vaccines. He'll be available for questions, but I want to give the floor to Dr. Jerry Abraham, who is the Director of Vaccines at Kedron.
Hello, everyone. My name is Dr. Jerry Abraham, and I am the Director of Kedron Vaccines at Kedron in South Los Angeles. We're very excited to be a part of this panel. We really want to help answer people's questions related to vaccines. Give me one moment. We're actually leaving a school-based vaccine clinic here in Wilmington right now. Every day this week, this has been school week, so we've been vaccinating students in preparation for going back to school. And so we just want to be here to help answer parents and students' questions, to make people comfortable with getting vaccinated, just the process. And we just want you to know that these vaccines are safe, effective, and free. And if they weren't safe, we wouldn't be offering them to children. We want people to know that they have gone through an FDA process, that they did achieve emergency use authorization for ages 12 and older. And that, you know, one of the best tools we have, as Dr. Burdock and as Superintendent Bowers and others have mentioned, one of the best tools we have at preventing COVID-19 and at ending this pandemic is for many of us that are eligible to get vaccinated. So again, just one of those very important layers, and we're happy to answer any vaccine related questions with you today. And thank you all for your time. Thank you, Kimberly.
Thank you, Dr. Abraham. Next, we'll hear from Jewel Forbes.
Thank you, Kimberly. Good afternoon, everyone. My name is Jewel Forbes. I am the project director for Community Health and Safe Schools with the Los Angeles County Office of Education. So we've had our wonderful speakers who have shared kind of the physical side of the COVID pandemic. And I'm going to switch gears a little bit and talk about the social emotional piece, the well-being of our students. So my primary role at the County Office of Education is to coordinate mental health services and counseling services to support the 80 school districts within Los Angeles County and charter schools. So with the pandemic, significantly, it impacted the mental health needs of many of our students. It's critical that schools develop a universal system of support to address their needs. For many youth, this time has been filled with loss, not only related to deaths of a loved one or a family member, but also loss of other things that are significant in their life, loss of education, loss of peer relationships, changes in their daily routine, social connectedness with their friends. And students have experienced increased levels of trauma and also are dealing with issues of equity. School counselors, we know, play a very vital role in assisting youth during this time. We are looking forward to having students return to school and working with counselors so that they're able to access mental health services. One of the things that we saw during the pandemic was increased levels of anxiety, levels of depression among students. And so for many youth, they often suffer in silence because during the pandemic, many families didn't know how to access mental health services or services around well-being. One of the things we know is that, and data shows that during the pandemic, access to mental health services seemed limited. So many families went into the emergency rooms or into urgent cares trying to access mental health services. Well, that proved to be very dangerous for many families because of the COVID variant. So I want to share some of the things that we've been doing at the county office, preparing to welcome your students back. So in partnership with Department of Mental Health and with UCLA Center for Excellence, we have implemented a varied array of different student services so that you as parents can access mental health and well-being services at every level without cost. So during the early stages of the pandemic, we learned under the safe at home order that we might be in the safe at home order longer than we really thought. So one of the things we did was created a joint messaging that was released to Los Angeles County via our superintendent, Dr. Deborah Eduardo, and Dr. Jonathan Sharon, who is the director of Los Angeles County Department of Mental Health. We started with a universal referral system that all 80 school districts can use to refer students who might be experiencing mental health issues. We also increased our level of trainings for school staff and school-based mental health professionals so that they were equipped with tools and resources to assist students who may be dealing with mental health issues. We held weekly counselor level-like meetings and offered specific mental health resources in the area of trauma and crisis response. We also looked at how could we help counselors really take care of themselves. We know when counselors are well, they are better equipped to serve students. We also collaborated on different levels with UCLA to create a series around overcoming stress and looking at trauma throughout the community. Fast forward to today, one of the primary things that we're working on in preparation for schools opening is really looking at how do we identify trauma? What things are in place and what pathways to healing exist in each of the 80 school districts. Realizing there are multiple avenues to healing. We are launching this year with a symposium that really shares the theme of it takes a village. And so we'll be working with many of our community partners as well as the 80 school districts to offer technical assistance, to offer referrals for mental health services, and really to support you as parents in any way that we can. I look forward to working with all of you, and then I'll hand it back over to Kimberly.
Thank you, Jewel. I'm so glad you were able to join tonight and talk about that. And I have a feeling that you're going to get quite a few questions because we have had that parents have questions about that. Lastly, we're going to hear from our ambassadors. We have a parent ambassador and we have a student ambassador. So JP.
Hello, thanks for having me here on the panel today. I want to let everybody know that I know I'm surrounded by all the experts and doctors, but I'm here as Mr. Dad. I'm a parent, and I'm trying to give voice to the parents and speak directly to some of the issues that the parents are going through. I've been on numerous town halls in the past week, coffees with principals. There are an overwhelming number of questions and concerns. And when we have these panels, we try to address as many as we can. I just want to remind everybody, the last panel we had over 780 questions, and we can only get to so many of them. And as far as what's happening, I represent the parents at LAUSD, and a lot of the questions are talking about different districts. And if I could make one little suggestion, if something's working at your district, if something is actually going well, please put it in the Q&A so that we can share it and other people can read it, because we are really looking for solutions. Now, one of the things I did, I wrote a letter to the LAUSD board because a number of parents were having issues making it to get to the testing site at the school for the days that it was scheduled. A lot of people have more than one child, more than one school. I did attend a town hall with LAUSD board member Nick Melvoin. I asked him directly. He agreed. I'm trying to see if that's formalized yet. We're asking that all of the LAUSD school, the test sites, allow for walk-in, no appointment student testing, regardless of whether the student goes to that school. The closer we get to the starting date, the more important that's going to, the more important that's going to be. But there are responses, there are actions that even if it feels like nothing is being done, there is an overwhelming amount of issues being handled. And at the panel last week, my fellow panelists addressed a good number of those, and it made me feel better as a parent. My kids are going to be going back to school. Now, I did have one thing I wanted to mention. The question about whether or not they can have hybrid schools. Board member Melvoin answered that question also. And there was a specific temporary law that allowed for hybrid. And for the parents who wish that they could still do that, like I wish we still had it available. That law expired. So if that can be addressed by anybody in the panel, that would help. I do know that is really a huge concern and desire by the people that are on the Q&A and all the different meetings I've been at. So number one, I would say for as a parent, making sure that the students can go to any of these sites and be tested. In LAUSD, it looks like that's happening or about to happen. I hope that can happen at countywide, statewide too. But let's make sure that we're looking for what the solutions are. And I'm gonna try to work the questions, the Q&A. And I'm going to turn this over to the doctors because most of the questions are going to come straight at them.
Thank you, JP. And lastly, we're going to hear from Neo Pouchain, our student advocate. We're very excited, or ambassador, I should say. Very excited that he could join us tonight.
Hi, I'm Neo. I'll be a junior in August. I go to Reseda Charter High School. So I think I have a unique standpoint here in this conversation because, of course, everyone's talking about, the solutions. What should we do for schools? How do we bring back normalcy? While I am on the direct receiving end of that. So personally, the reason why I got vaccinated was because I knew, or I believe that it's a great way to protect yourself. It is the way to protect yourself. And I also think that we collectively bear the responsibility to improve our public health, right? And I think that in terms of going to school, I feel like a lot of people can agree with me that there's a social aspect that comes with the benefit of going to school. I'm sure a lot of us are Zoom fatigued and tired of being on the computer all year. So I can see a lot of people, my friends included, being eager to go back to school. A couple concerns that I have that my peers also have is the accessibility of course, masks and sanitation, and how well or how can we ensure that these students follow these protocols, right? And also these, there are these things called the daily passes, and they basically assure that you have a negative COVID test and such. But some of us are worried about the security and the strength of this daily pass, or how can we make sure that people actually are negative, and how can we ensure that everybody is COVID free, right? So I think overall, the vaccine is a great step. It's the #1 priority to going back to school, and I'm eager to see what happens next. Thank you.
Thank you, Neo. And that's going to be a good segue to our Q&A portion, which we're going to start now. I see we have roughly about 70 questions, so I encourage you to put your questions into the Q&A so that we can address them or hopefully get to them. A couple of questions are being answered directly by the panel, but I want to piggyback on what Neo just talked about and see if anybody's able to give a little bit more clarity to the daily pass and how can the students be sure that it's accurate or true.
I wish I could respond to that one, but I believe the daily pass is something that's being used in his particular district or LA Unified. So I'm unfamiliar with how that works, but what I would encourage folks that are interested in that information to do is contact their school, and they can get more information, or go online, because I will tell you that we have just been really trying to build up our online information centers so that these questions specifically that pertain to your individual school, answers to these questions are found there or on the district web pages. So I encourage you to go there and look or find out who you can contact to get that answer.
Perfect. So I'm going to jump right in. I see a question that says, there seems to be confusion among the districts as to whether testing will be paid for by the state. Can anyone clarify?
I can speak to that. The school-based testing program is paid for both by the state and by the federal government. It is free testing, so schools can sign up. So, you know, in probably January, February, it wasn't totally free, but there was money that then got supported to the school-based testing program. So since April, it's actually been free for schools to be able to participate. It pays for software, it pays for the test kits, it pays for running the test. The only thing that is still something that a school district is going to have to support in some circumstances is the people to collect the test. So that's the only piece, but everything else is free, 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 free. So I'm happy to put, I'll actually try and find that answer, and I'll put the link in there to the school testing website. It's also actually, if you go to the schools hub, there's like a little card at the very top that talks about all the school testing, like it has links to the school testing stuff. So those are a couple of resources for you guys. Sometimes schools just might not have heard about it. We're trying to advertise as much as possible, or just spread the word as much as possible. But if you get that link, you can use that and send it to your schools as well, in case they didn't know about that piece.
Thank you.
Yeah.
Anybody want to add to that? Okay. This is a question that's come up on every panel, so I want to get out the way. I'm sorry.
Actually, I'm sorry. I do just want to add just a little bit,
Okay.
because not every school or every district will be able to do testing for every staff member and every child. And I know that some districts are taking that approach, but every district is taking a different approach. And while there are monies available, not every district is going to be accessing that. Not every district has the personnel to administer a full-on surveillance testing program. So again, this would be a situation where you might want to check with your district to find out what type of testing option they have available. Sometimes you can opt into testing, or they would have other resources in the community where you can go get testing. But to find out exactly what your school or district is doing as it pertains to testing, just give them a call.
Thank you. I see Dr. Burdock is about to address a question that I was going to ask, because it's come up on every panel, and so either Dr. Abraham or Dr. Burdock can answer this. Do we have any idea when vaccines will be available for children under 12?
For children under 12, Dr. Abraham here from Kedron Vaccines. We're really excited that we are vaccinating a lot of middle school and high school students and getting them ready to go back to school. What we know about vaccines for children ages 5 to 11 is that we are still collecting data from the clinical trials, and that we anticipate potentially having emergency use authorization for Pfizer sometime late September, maybe October. And that's kind of the latest that we've seen. And not really sure if Dr. Burdock, if you have any other additional information on that.
No, that's about the same information I have. Yeah. And it's just the FDA asks for there to be a little bit of a longer observation period because it's for younger kids, and they said, you know, let's get a little bit more information. And so it's another safety layer actually for those vaccines. There's actually 7 million vaccines have been given to youth across the nation, 12 and up. So a lot of amazing information we have about the safety of those vaccines. So just to reassure, and they're doing the same level of really looking at the safety before approving it for what's called emergency use authorization. And that's probably going to be mid to even late fall, because they want to do that careful look at the information.
You lightly touched on 12 and older. There's a question from a parent who's just not comfortable with their son getting vaccinated, who's 12 years old. Did you want to elaborate, maybe talking about the testing and why it is safe for those 12 and older to be vaccinated?
Mm-hmm. I can start off, and then Dr. Abraham, also great to hear your facts also and information. So like I said, it's been examined, and so we've had so much experience, 7 million doses in the United States and also across the world. Israel the UK, many different countries, a lot of experience giving this vaccine to youth ages 12 and up. There was some like a brief pause / looking at the vaccine earlier this year around what's called myocarditis, which is inflammation of the heart muscle, which it looked like there might be some cases of that inflammation of the heart muscle associated with the vaccine for some younger people, not really the teens, but sort of teens plus young adults. There was some signal, maybe that's happening. It does look like there's a little tiny bit of a risk of that happening. But the determination from the CDC and the FDA when they looked at it is that it's such a rare side effect. And when kids got that, or when the young adults got that, it didn't cause any long-term issues. It was usually very mild effects. So you have an inflammation, but it goes away pretty fast. It needs very limited treatment. And the last thing to say is that COVID-19 actually can cause an even worse problem in the heart that's kind of related. And so it's safer to get the vaccine and protected than the risk of having that vaccine because it's such a low risk. So that's the information we have. That's the thing that sort of people talked about if there was any concern that you might have heard of. And the safety data still seems to really hold up and be quite strong. So if you're weighing those risks in the balance, the protection from the vaccine is a big benefit compared to the risk of not getting it. So.
Yeah, I'll just add from our perspective, having now vaccinated over 300,000 people in our community, first and foremost, we just really want to remind people this is not a social experiment. This is really life-saving essential medicines that really help us protect ourselves and our community from COVID-19. We don't at all take for granted people's lived and real experiences. We talk about the Tuskegee trials, the abuse of Henrietta Lacks-Sells, the medicalization of rape, under treatment of Black pain are all very real issues. And yet when we come to this vaccine, especially when we look at the uptake of this vaccine, especially amongst Black and brown men, they are lower than segments of the population. And that really, of course, concerns us because we also know that Latin men and Black men are at much higher risk of dying from COVID and being hospitalized and having serious complications. So just really want to, I can't share enough how important these vaccines have been at helping our community survive COVID-19. And we've seen that those getting hospitalized and those currently dying, the vast majority are unvaccinated. Very few breakthrough cases of COVID-19 amongst those vaccinated. When it comes to parents and answering their questions, of course, this is a very difficult and challenging decision that parents are making. We know you are trying to do the safe, responsible, right thing. We know you don't want to do anything harmful for your kids. And we understand that, there are a lot of unknowns. So all we can do, as Dr. Burdock mentioned, is share with you what we know. And that, as she has mentioned, we have vaccinated hundreds of thousands of people that are middle schoolers, high schoolers, young adults now. And we have not seen any major serious adverse events. As we saw with Johnson & Johnson, when they paused the use of Johnson & Johnson, that really goes to show you the abundance of caution and the integrity of our vaccine safety, patient safety process to make sure that we understood why people had those complications and then make sure that we knew how to treat it. And then that's why we still use Johnson & Johnson today, because we found out that it still is safe and effective. And as Dr. Burdock mentioned, with the inflammation of the heart cells, putting those warning labels, letting people know, that's a big part of what we do is we make sure we answer people's questions, educate them, tell them what we know. We're being honest about what we don't know. And the best evidence are that these vaccines are safe, effective, and some of the best tools that we have at ending this pandemic. And we really do believe that's true for everyone over 12 years old, particularly all of our middle schoolers and
Thank you, Dr. Abraham. This question is interesting. The LA Times posted a report which said that 20% of students will be infected with Delta in the first 3 months, even with mask and test. Is that true?
So I saw reports of that study, or of that I saw the LA Times write up, and the report is actually not publicly available. So it's actually really hard to look at that and sort of understand where that number came from. And like I said, I'm deeply committed to paying attention to every single piece of information that we get to understand what's going on. The evidence we have so far is that there's that's not what we're seeing on the ground. The thing that is really, really, really important is to think about there are going to be community cases in children, and we're seeing that across the nation right now, particularly in states that have low rates of vaccination. But actually, there are some states, Arkansas, Texas, that have explicitly said you are not allowed to require a mask. You're not allowed to ask a kid in a school to put on a mask. And it's in those places where we're seeing the increased rates in kids. And it's affecting national numbers because we're seeing a lot of those kids. So in California, we're looking at our numbers where there are universal masking requirements, and are really strong safety layers and a commitment actually in general from our communities to do vaccination and to support safe schools. And we're not seeing those kinds of numbers. So that's to reassure people and put those numbers into context actually. So hopefully that's helpful. We do know that those safety layers are really, really going to be key for, and are part of the reason why we put them into the guidance, is because the masking and the ventilation and all that are actually really important pieces. So.
Thank you. I see a question. Our school system in Burbank isn't testing. Is there a reason why? I'm going to say that since we don't have a representative from Burbank, and since we know that each school district, as Dr. Bowers has said, operates differently, I'm going to encourage the parent who put that question in there to reach out to their school district or reach out to their school to get that question, unless somebody on this panel can answer that. Perfect. What are the current requirements for reporting COVID cases that occur in schools, especially classrooms where, well, it says especially classrooms where we have children, but let's just say, what are the current requirements for reporting COVID cases that occur in school? How do the schools contact the parents, or what does that process look like? Dr. Bowers, maybe you can talk about what
I was going to say, it's fun being the only school representative on the panel. Wait a minute. Well, actually, any time that there is a positive case, it has to be reported to the Department of Public Health. They monitor that. So we have an entire process that we go through, and we work with the individual to find out, to do the whole contact tracing, to find out who they have been around. So depending on who they've been around and for how long and what proximity and what were the circumstances in which they were around the individual, that will help to inform. That's the type of information we will share also with the Department of Public Health. And then we will work with the Department of Public Health to determine who needs to be notified and or quarantined from that point. So not necessarily does every individual need to be quarantined, because a person may or may not know. A person may be symptomatic in a school setting. Let's say a child may be symptomatic or have a fever. Does not necessarily mean that the child has COVID. So we have to go through an entire process. If your school or school district has testing there, then hopefully they will be able to test the child before they go home. And usually the child will be removed from the classroom setting and taken to what we are calling a wellness room, where they can be isolated with proper supervision. We will have an adult there until their parent or guardian can come and pick them up. And in the interim, obviously, we will make them comfortable. We will make sure that, to the degree, if the parent agrees, that we are allowed to test them, so that they are reassured whether or not the child is testing positive at that point in time. And we know how to respond to that and can provide that information to the Department of Public Health. If the child or the school district is not able to test the child before they leave, then we would ask the parent or guardian to consider getting the child tested and provide us with the information or the results of the test so that we can proceed accordingly. Anyone that is in close contact with a person that is tested positive, whether it's a student or an adult, will be notified immediately. And depending on the number of positive cases, working with the Department of Public Health, they will let us know if there needs to be a larger quarantine. So is it an individual, one or two individuals that may need to be notified, or are we talking about potentially an entire classroom setting? So right now, knock on wood, there have, given the number of students, and I know we tend to focus on the number of outbreaks or the number of students that have been, or individuals that have been sent home. But if we think about the number of students in totality that are going to school, the numbers that are being identified as positive are much smaller than you realize. It's worth sending the kids back, because for the most part, the kids are going to do what they need to do, and the adults are definitely going to do what they need to do to stay safe. So many of the schools and districts have health screenings. They may do temperature checks. I know that's something we were doing at the very beginning, but because of the larger numbers of students returning, the temperature checks may not still be conducted unless there are symptoms displayed or a child indicates that they're not feeling well, in which case we would do a temperature check. But we will work closely with the Department of Public Health to determine the response as far as who needs to be contacted, and the adults, the parents will always be kept in the loop if there is any concern about a positive contact or a positive test for COVID.
Yeah, thank you. And I just wanted to also add one other thing that I hadn't quite finished in my last sentence, like in my last answer, that's related to what Dr. Bowers just was saying, which is that we do know that there might be some cases in kids and cases in kids who are at school. The thing that is super important is that we have the safety layers in place that prevent that infection from transferring to another person. And that's what all these things are about, is actually preventing that piece. The other piece is, how do you even prevent the kid from coming in, or the adult from coming into the school with that infection? And that's where the vaccines are super important. Vaccines for the adults in the community. And we know from that those kids tend to get COVID vaccine from an adult at home. So that's why that vaccine actually protects not just that individual kid, not just that individual parent, but it also protects our school communities. So it's all those things kind of put together that are really helpful. So as you might hear about, oh, school, like there was a news article last week about a school that had 23 cases in it, but it wasn't them transferring to another kid. It was just that they had gotten it in the community. Exactly. So when you are reading an article, like parents, I'm empowering you when you're reading an article and you're saying, oh my God, those numbers are high, try to listen. Is it that they got it in the community, or is it they got it in school? Because what we've seen is that schools are really safe and they're able to actually be safe places for people to go to school.
Thank you. And I just want to add to that, to just really reiterate that that's exactly what we're seeing. If there is a positive case, more often than not, we have not had any case where it's transmitted within the school building. It's something that someone was in contact with someone at home, on vacation, on a trip, and brought it in. So that's one thing. And then the other thing that you touched on in your presentation, and I think it's important to just mention it again, especially as kids return to school, because we had a little different mindset before, where we said attendance is important, and it is. But if your child is not feeling well, keep them at home. So if you stay home when you are not feeling well, and that's the adults, we are really pushing that with the adults, and we're really pushing that for the parents to consider for their children, because the symptoms are similar. And we want to err on the side of extreme caution. So if they're not feeling well, keep them at home for a couple days, get them healthy again, make sure that they're feeling well, and let's make sure before they come into the school building that they are healthy.
Could I address something? This is JP. Now, the committee that I'm an officer for at LAUSD is it's for special education students, special needs. And their needs are very specific. There's been some questions, and we have had some answers offline and at the town halls on how the special needs students, some of them have physical assistant, who literally has to help them to attend school. And some cannot wear a mask because of limitations. And it's being addressed, and of course, it's an extremely difficult thing to handle. But we've been told that there are additional physical space for those students who need that situation. So they will be physically in a separate space if that's what's needed. It's going to be hard to accommodate and accomplish, but they are dealing with it. It's not being ignored. It's an extremely crucial matter. And trust me, those of us who advocate for these students are passionate, and we are known to insist. And I do wag my finger. So I'll just let you know that.
Thank you, JP. Really glad that you're on the panel to be able to provide that aspect, because that is important. And I'm sure there are parents who have that same question. I have this question that I believe is going to be targeted towards Jewel. And it says, we've heard a lot about emotional support when kids return to school in person. My elementary school student has a medical issue and may opt to do independent learning. Watching his friends return to school while he had to stay at home was incredibly difficult last year during hybrid. I can imagine it will be just as hard this year. What support is available for children who must educate at home?
Oh, such a great question. And we get that question a lot. And so that's one of the things that we are working to develop now in partnership with Department of Mental Health. There are counseling services available, and they will be available as telehealth services or virtually for a child, especially when we're taking away something that is normal in a child's life. So those are some of the services that you would be able to access through the school counselor. One of the things I'm hearing is that a lot of elementary schools do not have counselors. I will make my information available. And so if you have questions around accessing services to counselors or mental health professionals, you can reach out to me and I will link you with a specialized counselor that can work with your child.
Thank you. Along the lines of that,
Kim, I'm sorry. I'm sorry. I just want to add to what Jewel was saying, just to remind people that there are lots of resources in their community as well that offer free mental health services. So it's not just through the school district. So I would encourage you to access, if there is some sort of center that provides you information on different resources in the community. Sometimes the schools can be that center, even if they don't have the counselor, they may be able to let you know of various resources in the community. Other things that you can consider for social interaction is seeing what's available through Parks and Recreation, other third-party organizations that provide activities for kids that might be appropriate for your child and still allow the safety net that for as far as the health and safety, but also allow for the social interaction and the opportunity for them to deal with other kids, their peers. So don't just single it out to the schools. I would just encourage you to think about some of the other many resources that are available in our communities.
Such a great point. And one of those I can just highlight is there's Our Spot, but depending on the area where you live, there are multiple online teen activities or youth activities. Dr. Bowers really highlighted Parks and Rec because they have really been a great partner during this time. And they've specialized in really providing online activities and options for youth to interact online safely, because I know that's always a concern. So thank you highlighting that as well.
Thank you both. Jewel, I think you touched upon this earlier, but I want to acknowledge a question, and it talks about social, emotional, and mental health services, not just for the students, but for the educators and teachers.
Yes. So a couple of things. I know we were short on time, but one of the things we've done in partnership with UCLA, they have an online on-demand series available for educators. It's an overcoming stress series. It's a series, and it's a free account that you create through UCLA Wellbeing. The site is Wellbeing for LA. And if you just put that into your search, you can access that, create a free account, and it will give you access to free online resources and modules. Some of them around overcoming stress. There's also things around equity and some of the issues that we've been seeing in the news. But the other piece, if you are a teacher within LA County, you can also access employee assistance for stress or anxiety or services that will help you during this time. We realize that teachers are suffering from the same things that our families are. You know, they're stressed, they're frustrated. Many of them experiencing anxiety. And so we want to make sure that we're front loading those services to make sure that educators can access services as well.
Thank you. I'm sorry, before I move on to the next question, I want to read a few comments, Neo. I don't know if you're looking at the comments, but I just wanted to acknowledge it. Someone says, agree on the importance of vaccines, Neo. Thank you for being here. Someone else says, you know, you're very well spoken and they appreciate your words. So I just want to acknowledge, Neo, that your presence is appreciated here on this panel, though many of the questions might not be directed at you. I think that your words were very impactful. So thank you for attending and being a part of this.
Thank you for inviting me. Thank you.
Absolutely. We're going to dive back into this Delta variant. There are a couple of questions that are asking about. Dr. Burdock, you shared some research, and they're asking, was that research at the time considering the Delta variant? And if it did not, how is the research being adjusted or these findings being adjusted to address the Delta variant?
Mm-hmm. So the data from the ACE2 receptor study, which was that one about the doorways, that the elementary school students tend to get sick less often and with less severe symptoms, that difference across the age groups is still true for Delta. Delta is about 2 times more contagious, meaning it's easier to pass from one person to the other. It doesn't seem like it's more severe, and certainly not in kids. It doesn't seem to be making them any sicker, but that contagiousness, that's still the same. It's like, it's still less contagious in the youngest age groups compared to the older age groups. So that is something that we're finding. The other piece of the other information we have, particularly around Delta variant, that informs us about schools, that gives us information, you know, that teaches us about schools, is that from North Carolina, where they basically learned a lot from about half of their school districts reported testing results and sort of what was going on in their schools during the last 3 months of the calendar school of the school year. So that was like April, May, June, when the Delta variant was already somewhat in their community. So it's not perfect data, but it gives us some information. They still saw the same kind of patterns that we were seeing before, which is that in school transmission was very, very, very limited, meaning that transmission was not happening in the schools. And that was actually, they did that in the context of masking, ventilation, but they actually didn't have a minimum physical distancing. So that 3 feet versus 0 feet versus 6 feet, whatever, that there was no minimum that they set for their schools. And they still found that there was very limited transmission. So I see there was another question in the chat about the physical distancing piece of it. So that experience from North Carolina was actually very helpful, that they shared it with us, and they shared it actually with the state of North Carolina and made it publicly available. So that's the information we sort of have about schools in Delta. And then we also have information from other countries, Israel, the United Kingdom, also known as England, where also it looks like if you're wearing your masks, it still is a very protective layer. And they were able to do school still successfully. When they had Delta earlier than we did. So great question.
Thank you. Being that this is the LA County panel, I want to make sure that we're acknowledging some of these other unified school districts. And so there's a comment from Bonita Unified. And it says Bonita Unified starts school on August 23rd. We have received communication from the superintendent indicating we are returning to pre-pandemic scheduling, but his communication did not mention anything about whether or not masking will be required. It didn't give any details about what school will look like. Shouldn't we have details by this point? I am worried that masks will not be mandated or enforced. And we might not have that answer, but maybe there's somebody who can give this parent some counsel as to the best route for them to get their answers.
Well, while you were talking, I was trying to be efficient, but Neil's probably way faster than I am at looking it up online. So I'm going to continue to try to look it up online to see if there is information, but without knowing for sure right now, what I would suggest is that the parent contact the school district. If it is in Los Angeles County, and that's one of the things I was trying to, it's in San Dimas. So you would definitely need to contact the school district or just contact the school and see whether or not masks are going to be required for that area. They would probably have it posted or included in a safety plan. Most school districts or schools have some sort of safety plan as to what parents can expect and how schools are preparing for the safe reopening of schools. So that information about how schools are preparing and how they're going to respond to COVID cases or any symptomatic students or adults should be part of the information that's provided and available to parents online. But I'm going to browse around here, and if I come up with a response, I'll jump back in.
Thank you, Dr. Bowers. I'm sure they'll appreciate that. Here's a general question I'm sure many have. If my child has symptoms of COVID, how long do I have to keep him home? Do I always have to get a COVID test if he has symptoms?
Maybe I'll start out with that answer. So if the student or a teacher or an adult staff person at school has symptoms of COVID-19, and there's kind of a list of them, the school should have that list, but it's kind of like other cough and cold symptoms: runny nose, sore throat, headache, feeling tired or fatigued, body aches. Those are and then very specific ones: loss of smell or loss of taste. Those would all be reasons to stay home and get a test. So some schools there's some flexibility there, because the alternative, if you don't want to get a test, is to stay home for with what's called quarantining, which is, or actually that technically is isolation, but stay home for 10 days if you prefer not to get the test. Most schools will encourage families to get the test because the test is a pretty straightforward thing to do. And many schools are working on trying to have tests available either at their school or through the school district or through the local public health department to help that. But that's the recommended thing to do, is get the test and then come back to school if it's a negative test. And maybe I'll say one other thing, and then, sorry, it looks like Dr. Bowers is also going to help out. To talk about the test. When we first started the pandemic, the test for COVID-19 involved putting a swab, like cotton, Q-tip, basically all the way back in your nose. People called it the brain picker sometimes. And this testing that is now mostly being done in schools. Some people are doing saliva-based tests, so no more big swab in the nose. You can just spit into a cup. Sometimes kids find that a little harder to do, actually, than having some in their nose. But that's one way that people are doing. I think LAUSD is doing a lot of the saliva. And then the other thing is that we found out, probably last fall, that you can do what's called supervised self-collection with students. And students, even as young as kindergarten, they hold the swab. They just put it in the front part of their nose and they roll it around on one side for 15 seconds. They roll it around on the other side. And most students are really comfortable doing that. And they're willing to do it again, is what we found. And so just to reassure parents, if they're feeling like, if they've heard about that really deep one, that is really different now. And so kids are really able to do it. And I joke that it's like kind of like picking your nose with a Q-tip, which is, kids are pretty good at that, and they seem to really not mind it. So now I hand it off to you, Dr. Bowers.
Thank you very much. The only thing that I would add is I saw a question in the chat box. What happens as far as instruction goes if the student is quarantined? And yes, there are ways that instruction would be able to continue, primarily through independent study during that time that the student is staying at home or quarantined. And the same would be applicable if it were a class that was staying at home. So there's going to be accommodations made to make sure that if the student is able, if the student is well, as far as not feeling symptomatic and able to do their work at home, then they will be provided an opportunity to do that through independent study so that they don't fall behind. And then the only other thing I will add is that I did find the information on Bonita School District website. So they do have it under COVID-19. They have all of their safety protocols and everything. And it does appear that they are going to require students, staff, and visitors to wear face coverings while indoors in a school building or facility.
Thank you.
You're welcome.
Along with that, another question was, are volunteers going to be able to come on campus?
Again, you'll have to defer to the school or school district, but I would say at this point, given the numbers, more than likely not at this time, only because we're trying to, most districts and most places are trying to minimize the number of contacts that are, I don't want to say unnecessary, but if it's a volunteer thing, we're just trying to limit it to the people that really need to be there at this point in time. So we'll probably try to minimize to the degree that we can volunteer visits until the health and safety conditions are a little bit steadier, because we can't control whether or not a person that's volunteering or visiting has been vaccinated. We can't, there's a lot of different things that we can't control. We're not doing our daily screenings. The things that we do to mitigate with our students and our staff, we would not necessarily be able to do that with each and every visitor that arrives on the campus. So we will probably err on the side of limiting visitors at this time.
I think that's pretty understood. Thank you. Let's see. This was a question that's come up in a couple of different panels. What efforts are being made to keep students in their separate classes, grade levels, and cohorts? Are they going to be mixing together in common areas for recess, lunch, playground, etc.?
It's much easier done at elementary, I will tell you, than it is at middle school and high school. And that's because at elementary, usually the students are assigned to a single teacher, with the exception of sometimes resource or other instances where they interact with another adult for additional support. But at elementary, it will be far easier to keep the kids together in a kind of a cohorted situation environment, so that they'll be in the classroom together. They'll probably be in the cafeteria together with their class eating. And then when they're outside, they'll be able to spread out. And yes, they probably will have an opportunity to be outside with other students, but they will be outside and they will be spread apart. So we won't be doing anything, close up together, even if they're outdoors. They'll be spread apart, and then those numbers will be limited. And at middle school and high school, it's going to be far different, because I'm sure they will still be, we have middle school, we don't have high school, but the students go from class to class, period to period. So they will be mixing, and they will not be in that cohorted situation, and they will go from class to class. But because they will be going from class to class, there will be these other layers that are going to be in place to help mitigate the spread, are going to be critically important, which is one of the reasons that it's wonderful that that's the same age level that can get vaccinated. So if those kids can get vaccinated, they are probably the most at-risk group of the students that are going back to school, because they're going from period to period. So that is another reason, good reason, for them to strongly consider getting vaccinated.
Thank you. We're at 7:24, and I'm gonna fit one more question here because I want to throw the mic back to Dr. Burdock and let her give us some closing comments. And I also want to be able to share the website and a number where you can find out more information about Safe Schools for All. A lot of the questions are talking about social distancing. How parents understand that there's not social distancing in the classroom. Why is that? And is there any type of distancing between the students, or how is that being addressed?
Maybe I'll start out with some of the science, and then also Dr. Browse, if you want to talk about sort of the other things that schools are always going to be thinking about. So the physical distancing, the minimum physical distancing pieces that we saw last year, we all started out saying 6 feet, 6 feet, 6 feet. And then they looked at schools that were open across the country, and it looked like that 6 feet of different distance was actually not key. They looked at schools that had 3 feet of distancing, 6 feet of distancing. They didn't really see any major difference. And then there's that study that came out of North Carolina, that information from North Carolina that showed that even with no minimum physical distancing, that as long as there were masks in place and those other safety mitigation layers, the ventilation, the washing the hands, staying home when sick, that there was no major transmission. It wasn't a place where schools were spreading things. And because of that, we understand that physical distancing in and of itself, by itself, was not like a key layer. We also saw that in California and across the nation, it meant that it's part of what drove the hybrid model, where kids had to stay out of the classroom because we couldn't fit everybody in. And so as we think about the balance of, what we're dealing with in COVID is causing bad effects through infection, but also causing bad effects. We know that kids who stayed home from school they suffered in many ways last year with the, there was learning losses, there was social emotional issues, and mental health, increased levels of mental health distress for a lot of students, which I think probably many parents know about because they've experienced it firsthand, as I also did actually. And so as we think about those two things, if it's keeping kids out of school and it's not clear that social distancing or physical distancing really was helping us that much, it makes a lot of sense for us to say, okay, we can do some social distancing or physical distancing if it works for a school. There's no reason, that nobody's saying you can't do it, but there's no minimum physical distancing that is a clear indication in order to help keep schools safe. So we look to those other layers that really we know are good layers that are keeping us safe.
If I could give one tiny bit of dad advice. A lot of questions have been about different districts that we don't have coverage here in this panel. And we couldn't answer some of them confidently. Please call the school. Please call the school. They'll answer the phone. And if they don't have the answer at the office, tell them you're gonna call back the next day and that you're gonna want an answer. And ask them who else you may be able to call within the district. But it's your voice. And please, that we all put our voices together to try to get the best that we can. Thanks.
Thank you, JP. You stole my thunder because I like to end these panels with really encouraging parents. We couldn't get through all the questions. We couldn't answer all the questions. There are, what they say, 81 districts in LA County. Please, parents, be empowered, be confident, talk to your schools, take it upon yourself to get those answers. Be persistent. Be persistent. The answers are there for you. Be encouraged. I hope this panel has sparked questions, has sparked your inquisitive side, and that you'll be encouraged to continue this conversations with your students and your student schools. So with that said, I'm going to let Dr. Burdock take us home with a couple of comments, and then I'm going to close us out.
Thank you so much, Kimberly, and thank you to everybody on the panel. I learned from all these panels, and it's really important work that everybody's doing. So, we've been sort of finishing up these panels with sort of helping, like a call to action, giving parents what to do, and it's always helpful to feel like A, you're empowered, and B, you're empowered to actually be doing specific things. So, helping to people remember, first of all, it's a community issue. It's not just a school issue. We are in it together. the only way to get through this pandemic and to fight COVID-19 is to actually do it together, working together. So that's one really helpful, important thing to hopefully take home. And then specific things that you can do as parents to keep your students and your kids safe, keep your family members safe, getting vaccinated. You've heard it from us throughout the panel, and just reminding you that's one very tangible thing you can do if you haven't already done it. And if you have questions, talk to your primary care doctor, educate yourself online also. And then lastly, talking to your child, helping them anticipate what's school going to look like. I'm going to be wearing my mask again. I'm going to be washing my hands, but I'll be back in school and I'll be listening to my teacher. And when I wear my mask and I do those things, I'm helping me, but I'm also helping other people, because kids really appreciate being able to feel like they're helpers. And so giving them sort of a picture of what school will look like, and then also a sense of contribution and being part of a community. So those are a couple of things that hopefully are helpful to people. And I want to just say thank you again to all of our terrific panelists and to all the families who are really engaged and asking wonderful questions and being here and looking out for their kids and for their schools.
Thank you.
Mm-hmm.
I put this slide up here because I want everyone to be able to screenshot it, copy it down, whatever you need to do. You can go to the Safe Schools for All website, the parents page in particular, for ongoing updates, key resources, information. Everything that hopefully you need to know is on this page. And so we want you to visit this page. You'll be able to find uploads of the panels. We've done 5 panels in different areas. You'll be able to find the recordings of those if you'd like to revisit them. And also, if you don't have internet or digital know-how, there is a hotline, and it's 833-422-4255. I just want to thank this panel, Dr. Burdock, Dr. Bowers, Dr. Abraham, Jewel Forbes, JP, Neo. Thank you so much for giving your time, giving your comments, giving your perspective. I hope it was helpful to our attendees. I hope that there was something that you needed an answer to that we were able to provide. And again, if we weren't, please reach out to your schools. Thank you very much to everyone. Have a great evening.
Thank you, everyone.
Thank you so much. Take care.
Thank you. Bye.